happy Friday morning, November 20, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Friday morning, so let's begin. First up, we begin with your COVID-19 updates. Coronavirus in New Hampshire, key information and data. Let's take a look at that right now. And here is a look at that information for all of you right now. There are 16,277 number of people in New Hampshire have tested positive for COVID-19. 11,674,074 number of people in the United States have tested positive. 506 number of deaths from COVID-19 in New Hampshire. 826 number of people who have been hospitalized with COVID-19 in New Hampshire. And 251,970 number of deaths from COVID-19 in the United States. And let's take a look at this current map of New Hampshire where current cases of COVID-19 are. Nashua, 410. Let's take a look at this map of New Hampshire where total cases of COVID-19 are. Nashua, 1698. And now let's take a look at these three charts here. Let's start with the first chart here. New cases each day in New Hampshire in the purple. Daily new positive COVID-19 cases. In the orange, new hospitalization. In red, deaths. Let's take a look at this chart here. Current cases in the purple. Total current COVID-19 cases. And in the orange, current hospitalization. Let's take a look at this chart here. Total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalization. Red, death. And blue, recovered. And now let's take a look at this chart here. Positive PCR test rate and daily PCR test. Let's take a look at this chart here. Age group of cases, female and male of cases, and risk information. And let's take a look at this chart here. Infections, hospitalizations, and deaths. And let's take a look at this chart here. Deaths, percent in New Hampshire population, race/ethnicity of cases, and hospitalizations. And a reminder, your common symptoms: fever, lack of smell, cough, chills, difficult breathing, nausea, vomiting, and diarrhea. How it spreads, and prevention tips. And be sure to stay with the Riley King Network for the latest of your COVID-19 information. Today, the mask mandate for New Hampshire went into effect today. It went into effect at 12:01 a.m. at midnight. Sununu issues a statewide mask mandate in effect to slow the spread of COVID-19. Mandate starts today. Applies to indoor spaces, outdoors, where distancing can't be maintained. Let's take a listen to that video from WBUR News 9, Adam Sexton.
At Honda, we take the holidays seriously. With serious style.
Driven by data and the threat of a virus that's spreading through every county, Governor Chris Sununu is mandating masks across New Hampshire.
It works. The data shows that. It has been proven. The social distancing, incredibly important as well. But today we're really elevating that message even further given the seriousness of the current crisis.
Effective tomorrow, it'll require everyone over the age of 5 to wear a mask in public places, indoors or out, where social distancing isn't possible. The governor says the numbers show this move is needed now, with a 100% increase in the 2-week hospitalization rate, outbreaks in long-term care facilities, and a 4.1% test positivity rate.
Our numbers have been consistently rising, maybe not as fast as other states, but they are rising, and that right now there's no sign that they're going down.
As for enforcement,
education is the best tool that we have in that, and that's really what we're going to be relying on.
With hospitalizations doubling and facilities facing a staffing crunch, Sununu hopes this can alleviate that strain as well as keep people safe and the economy open.
The data is clear. If folks don't want to look at the data, I can't force them to listen to reason, but it is clear. It isn't speculation. It isn't conjecture. It isn't a hoax. This is so real, and it is skyrocketing all across the country.
The mask mandate officially goes into effect in about 2 hours, just after midnight, and will last at least through January 15th. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. So again, New Hampshire's in a mask mandate. Coas County Nursing Hospital needs staff PPE as they deal with COVID-19 outbreaks. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
At Honda, we take the holidays seriously. With serious style.
The Coas County Nursing Hospital in West Stewartstown has been dealing with a rising number of cases of COVID-19 among patients and staff.
Every day I learn more people being positive.
Right now, there are 37 residents with COVID-19, roughly half the people there. 3 have recovered and 3 have died.
These came so fast after diagnosis that was really hard.
38 nurses have also tested positive, which is a quarter of their staff. 27 of them are not working.
Some that are positive are actually coming in, and because of our essential worker clause, they are actually working in the COVID unit with COVID positive residents.
Management has had to fill in on the floor at times to help. The facility still needs roughly 10 full-time positions as well as more personal protective equipment. Tonight, the commissioner of the Department of Public Health says PPE is being sent, but acquiring staff is a current problem.
We're going to continue to work to do everything we can to try to find additional staff for Coas County, but I think that they're going to have a very rough couple of weeks.
To help control the spread, the state is conducting testing every Monday.
In the meantime, if a resident shows any symptoms, then we have the ability to use our rapid machine, the BD Veritor, or now these Binax Now cards, and so then we can get a jump on it.
Right now, only essential workers are allowed inside this facility. They are connecting with families through video and phone calls during this difficult time. Reporting live in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Disaster loans available as extreme drought area expands in New Hampshire. State officials urge water conservation. Let's take a listen to that video from WMUR News 9, Ray Brewer.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and our grandfather George did.
11% of the state is into D3, extreme drought, with the rest of the state at D2 or D1.
The recent precipitation did help somewhat, but not enough to slow the expansion of the area, now dealing with an extreme drought.
From Stafford County, we did extend D3 west into the upper Merrimack Valley.
The Merrimack River is down about a foot from where it should be at this time of year. It's still in a better place than it was in August, when the situation was even worse.
But about 400,000 Granite Staters are currently dealing with some sort of water restrictions, according to the state, and groundwater levels are continuing to lower.
This impacts well systems across the state, both for community water systems and for residential wells.
If you're wondering about your individual well, there are some things you can check.
Look around your neighborhood, see what the surface waters look like. Are your ponds low? Are your streams low? If they are, that's telling you that surface waters and groundwaters are falling in your neighborhood.
Other indicators of a problem: changes in water color, changes in the taste of water, and change in the smell. Given the current situation, the state says water conservation is increasingly important.
You should work to make sure that your children understand about brushing their teeth, turn the water off, really simple things like that, to running full dishwashers and full laundry loads.
There is still some time to recharge groundwaters. The ground won't freeze until late December or early January, but at that point, no more water will find its way underground.
Only rivers and streams and ponds that have not frozen on the bottom. than contribute to groundwater. And that will set us up in not good place for going into the wintertime and springtime.
Ray Brewer, WMUR News Now.
Okay, and there you go on that video and that report. Take a look at this. Gardner to seek a 23rd term as Secretary of State, praises local election officials. Record turnout. The nation's longest-serving top state election official was first elected by state lawmakers in 1976. And he will be seeking a 23rd two-year term in office, he said. Long-term progressive state rep Rennie Cushing to lead New Hampshire House Democrat Minority Caucus. House Democrats chose the 8-term Hampton lawmaker on third ballot of ranked choice voting process. And here is a photo of him right here. State health officials plan to vaccinate high-risk groups this winter, general public in the spring. Current understanding and vaccine will be free. Let's take a listen to that video from WMUR News 9. Okay, sorry about that, everyone. We do not have a video available at this time for that. Sorry about that. State officials said they are ready to receive the first dose of COVID-19 vaccine, which hopefully will be next month. The initial supply to expected to be limited, so those first doses will go to high-risk groups. That includes healthcare workers, first responders, and residents and staff at long-term care facilities. As of now, the plan is to vaccinate them in the winter, then everyone else in the spring, starting with areas with the highest rate of transmission. The vaccine will be distributed through a variety of providers, including pharmacies, clinics, hospitals, and primary care physicians. This is a major undertaking, and we're really fortunate in New Hampshire to have great partnership, and these partners are going to help us and collaborate together and get this big job done. That's before us, Chief of Bureau of Infectious Disease Control, Dr. Beth Daly, said. Now, state officials' understanding is that the vaccine will be free. Deadline set when to send your holiday packages. Let's take a look at that video. Let's see when we should be sending the holiday packages.
Retailers are very aware of the need to continue to maintain those health and safety protocols, following the guidelines from local and state and national health officials, ensuring social distancing, ensuring that their customers and the team members are in masks, all the things that we know will keep us safe and healthy this holiday season. And so we expect that that's going to continue. And we recognize that, this isn't about stores necessarily or the act of shopping being safe or unsafe. This is about individual behavior and the choices that individuals make. But we know this has been a year unlike any other, and we ought to expect that the holiday season will be just as different from normal holiday seasons as the rest of this year. year has been from normal years. And throughout the year, we've seen consumers consistently change and evolve their behavior. So we know people are shopping in different ways. The New Traditions campaign for the holiday season is about really health and safety and encouraging people to shop safely, shop earlier, so that we can do those things that we want to do. They're already putting those deals out there for the public now, so that you can take advantage of them now. And we should just recognize and understand they won't be there in that way on Black Friday, because we don't want tens of thousands of people rushing into stores.
Okay, and there you go on that video. And if you want to see that video again, we will share it with you on the Riley King Network Facebook page after that. The U.S. Postal Service encouraged people to send holiday gifts and cards early, and this year is no different. So send those gifts early, everyone. Dow futures edge lower as fresh virus restrictions rise. Concerns about recovery. Stock futures were slightly lower early Friday as rising new coronavirus cases doubt on a swift economic recovery. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.